I'm Teresa Dufort with your CT Style Express. While we're all hopefully enjoying the nice fall weather, it's important to recognize that we are still in the middle of a pandemic. Doctors stress that we still have to be careful, watch what we're doing. Joining us to talk more about this is Dr. Jonathan Benkoff, Chair of Emergency Medicine at Middlesex Health. Doctor, thank you so much for making time for us today.
Sure thing. Good morning, Teresa. Thanks for having me.
Sure, our pleasure. So people are outside enjoying the fall weather, but remind us how important it is to keep in mind we're still in a pandemic. You have to be safe.
Yeah, it's a great point. And as we transition out of summer into fall and schools are back in session, we certainly have enjoyed a little bit of fall weather. Right. We want to have people stay outside and enjoy that as much as they can. But as school has come back in session and people are moving back into their homes a little bit more, we certainly still need to kind of adhere to the rules that we've been following all summer, the protocols regarding masking and distancing, and making sure that people are still washing their hands and staying safe.
Sure. And doctor, what would you say to a patient that says, I don't want to go to a hospital, I don't want to see a doctor, but it's so important to keep up your routine care?
No, and that's a fair point. We've seen a lot of that actually over the course of the last 6 months, of course. People are nervous about whether they can still get care safely, whether that's in an emergency room setting or their doctor's office. And yet it's really important. Care doesn't stop just because there's a pandemic, and we need people to still make appointments, see their doctor for routine physicals, get screening tests, and certainly if they have an emergency to seek professional help.
Is there a way to make an appointment in the emergency room?
It's actually really, yeah, it's a great question. So speaking just for Middlesex, that's an area that we've established previously. We have 3 emergency departments, the main hospital here in Middletown, and then 2 freestanding emergency departments in Westbrook and Marlboro, respectively. The 2 satellites have had online emergency appointments available for several years. We've just now gone live as of this morning, actually, with Middletown emergency appointments. So now it allows patients and family members some convenience around their own schedule.
Sure.
It allows them to consider maybe not having to worry about waiting if they have an appointment. Their care will be more actively streamlined when they do present to one of our departments.
That's brilliant.
Yeah, we'll see if it works, but we'd love people to start using that service if it works for them.
Sure. And what can people expect when they do come for a visit, whether it is routine care or emergency room?
Yeah, certainly I can speak best mostly for the emergency department. That's where I work. But things have really changed since our normal pre-COVID environment. We've had to accelerate our process a little. We've closed our waiting room to visitors. We don't allow patients to really sit in our waiting room. We really want to get them into rooms, into beds. We've split our department into halves, if you will, a COVID and non-COVID side. And that's a fluid process. So that may change as COVID, unfortunately, may come back here in the fall. But definitely the focus is on efficiency. We're trying to get patients seen quickly, care for them well, and get them back home safely.
Sure. And let me ask you a little bit about COVID. Being in the emergency room, are you seeing the amount of patients that you saw, say maybe March or April? Is there that downturn?
Yeah, so it's back in March and April, Teresa, we really did see a significant drop in volume. I think emergency departments across the country did. As I referenced, a lot of people were concerned and really were even advised by some emergency department physicians and their primary doctors to stay home if they didn't need to seek care. That volume has come back. We're back now to, at least at Middlesex, about 90% of our normal pre-COVID daily census. But I do anticipate that number will go back down a little bit again as the fall and the flu season and kind of COVID comes back.
Sure. And just reiterate for our viewers that it is in fact safe to go get medical attention if you need it at the emergency room over at Middlesex.
Absolutely. Both here at Middlesex and anywhere for that matter across the state, I would certainly encourage people. The emergency department is very safe. We're very proud of the fact that we screen all of our staff when they come in. We have masks on everybody who enters the doors, patients and staff. And we take pride in the fact that last spring, we had very few of our healthcare workers sick with COVID because we followed all of these rules. So it's safe for patients to come back to receive emergency care and also in their offices for primary care.
Sure, it's important stuff. Don't forget those annual exams. Get the care that you need. Dr. Benkoff, thank you so much for chatting with us. And of course, learn more over at middlesexhealth.org.
It's my pleasure, Teresa. Have a good day.